Thank you very much, Secretary Burwell. I'd like to provide some basic but important facts about Ebola and its transmission. Although Ebola is an extremely serious viral disease with a high fatality rate, it is not easily transmitted. Specifically, the Ebola virus is not easily spread like a cold or influenza. You must come into direct contact with the bodily fluids of a sick person or through exposure to objects that have been contaminated with infected bodily fluids. Ebola is not a respiratory disease like the flu, and so it is not transmitted through the air. This is important. Individuals who are not symptomatic are not contagious. In order for the virus to be transmitted, an individual would have to have direct contact with an individual who is experiencing symptoms or who has died of the disease. We have considerable experience in dealing with Ebola, both in controlling and in preventing outbreaks. This is based on experience with almost 24 outbreaks in Central Africa since the virus was first isolated in 1976. The key elements to that control and the prevention of outbreaks when Ebola rises in a community is to first identify cases, isolate them, care for them under conditions that protect the healthcare workers, and importantly, perform contact tracing. People in direct contact with a sick Ebola patient should be monitored for symptoms for at least 21 days. If no symptoms arise, the individual is cleared. If symptoms arise, the person is appropriately isolated and cared for. This formula has worked very well over many years. The situation in West Africa has been very difficult, largely due to the lack of an adequate healthcare infrastructure to deal with the outbreak. And so I want to reiterate what the Secretary said. Our healthcare infrastructure in the United States is well equipped to stop Ebola in its tracks. As the Secretary said, in addition to managing the issues associated with containing the situation in Dallas as it exists today and addressing the very dire situation as it exists in Africa today, we are working very aggressively and energetically to develop and test a vaccine to prevent Ebola and therapeutics to treat it. And now I'd like to introduce Dr. Raj Shah, the administrator of USAID.
Thank you, Dr. Fauci. I'd like to take a moment to describe the effort in West Africa, which, as has been noted, includes a major effort to control the disease, includes specific actions to deal with the secondary impacts of the crisis in several West African countries, including making food, water, and government support more available, and the effort to build out an international coalition, as Lisa previously discussed. Our response in West Africa started in the spring and accelerated dramatically over the summer. This coordinated civilian response included the largest ever disaster assistance response team from USAID, the largest ever more than 100-person Centers for Disease Control capability deployed to Liberia, Sierra Leone, Guinea, and countries throughout the region, and efforts partnering with our Department of Defense colleagues to more than double the laboratory and diagnostic capacity in West Africa to ensure that cases could be identified and positively confirmed. Since that time, we've helped deliver more than 120,000 sets of personal protective equipment, build out Ebola treatment units, provide technical assistance for airport screening throughout the region, and increase the basic capacity of what has been a weak existing healthcare infrastructure to deal with this disease. As the President noted in his comments at the Centers for Disease Control a few weeks ago, our strategy now is clear. First, we are investing in a strong incident command system at the national and local level throughout the region to identify cases and trace contacts. Second, we are building out Ebola treatment units so that enough bed capacity exists for as many positively identified patients as possible to receive isolation and treatment. We are on path to put in place the WHO plan of more than 2,800 beds in Liberia, according to their timeline, and just in the last 10 days have seen significant new Ebola treatment capability come online, including the largest Ebola treatment unit in Liberia, the new Island Clinic, which we helped build and staff. Third, we're engaging in an extensive community care strategy that includes 10 to 20 bed community care center units that are placed throughout rural communities in particular to help isolate patients in those communities and support the distribution of hygiene and protective equipment kits so families can protect their patients and their families. We've distributed more than 9,000 of those kits together with UNICEF and the World Health Organization, and are on path to have about 10,000 arrive in country and be distributed through Liberia on a weekly basis. In recent days, we've been successful in scaling up the effort to identify, reach, and in a safe and dignified manner deal with bodies of patients who are deceased from Ebola. We now have more than 50 safe burial teams with full protective equipment and careful protocols in place, and we're noting that more than 3/4 of all bodies in Liberia of positively identified patients are now being cleared safely within the 24-hour period. This is critically important because that is an important existing mode of transmission. I'd further note that the scale-up of Centers for Disease Control and USAID efforts through June and August was quite significant, but the complexity of building out Ebola treatment units and providing the logistics support in terms of protective equipment and medicines required the significant additional resources brought by the Department of Defense and announced by President Obama. So I'm pleased to introduce General David Rodriguez, the commander of Africa Command, to describe those specific efforts. Thank you.